I'm being zoomed this in. Are we zooming? Is anything happening? Uh-oh. What's up, everybody? Welcome and welcome back to my channel. Dr. Cash is in your building. I'm so excited. I am so excited about today's video. I put out on a few of my social media platforms that I wanted to do a Q&A, nursing edition of course, and I wanted you guys to kind of give me some questions that I would answer, and to my surprise you guys sent a lot of them. I didn't get a chance to read all of them, and I did that because I want my answers to be very authentic and not pre-calculated, but for the ones that I did see, they're really good. So I'm so excited. I've never done anything like this before, so if this is a little bit all over the place, please forgive me. I do want to excuse the fan. I'm not sure if you guys can hear it, but it's warm in New York. Today is the 5th of July. 4th of July weekend in New York this year is not really giving much. I mean, I think people were just very much so celebrating Juneteenth, and you know, whatever. I'm off. I'm home. I have my wine in my wine glass. Because we're starting the day. But nevertheless, guys, let's get into these questions. All right, so the first question says, what was your first urinary catheter experience like? Is it easy to do on men or women? I'm not sure if I'm going to be sharing exactly who asked these questions, but this one came from Rob. What's up, Rob? I don't really remember my first experience too much. I know that I was paired up with a nurse named Ellen. Ellen is one of my favorite nurses that I used to work with when I was at the bedside, and Ellen is a very stoic nurse, but she was very gracious and showed me some of her techniques. Of course, when you go to school versus you being in the field, things are completely different. You get to see things in real life, and coming from school, coming from a fresh batch of knowledge, I'm looking like, I don't think that's how they really taught it to us. But nevertheless, she did keep her sterile technique, and I was able to kind of pick up on some of the ways. After I was paired with her, I would bounce around and be paired up with other nurses, particularly like when I was in my precepting phase, and I picked up little by little how nurses were doing their casts. I'm like, no, this is not good. This wasn't a good technique. Oh, this is a good technique. So I don't really remember all the way my first experience, but I do know that it's in doing them often, I do prefer to put Foley's on men because it's easy. It's a no-brainer. It's one hole, you go in, it is what it is. If you find a little bit of resistance, maybe it could be a prostate issue, or maybe you actually have the wrong size French. Like, let's say you have like the wrong size catheter, it's too big for the actual hole, you just change it out, whatever. But men are definitely easier than women. Women are a little bit more complicated. It's a lot of hand-eye coordination, a lot of practice, a lot of like, okay, let me make sure that I'm actually not looking at the vaginal canal. Am I looking at, you know, the right part? You know, the anatomy is a little bit more complicated, and every woman is built differently. So I would say my preference is men. Now, just in speaking of that, I'm just trying to think of if I've had a negative experience with a man. Not necessarily. I mean, of course you are going to be manipulating the area, so sometimes you might have a bit of a reaction, but it's never been anything grave. It's nothing that would make me feel uncomfortable, and it's nothing that has made the patient feel uncomfortable. The next question: who was your favorite friend in nursing school? Nancy. You know the answer to this one. Nancy was one of my favorite friends in nursing school. We are very good friends to this day. If you follow my my vlogs, like when I first started really getting onto this YouTube thing, you will notice a friend of mine. She's a nurse practitioner as well. She studies. Her specialty is geriatrics. But Nancy is my home girl. Not only do I just love just how she is as a professional, I love how she's just flexible. She's flexible, she's just amazing. We kind of relate on the same level in many aspects. We both share the same sign, our birthdays are around the same time, we have the same interests. Nancy's like one of my favorite friends in nursing school. Nancy is, I've definitely been able to say that since graduating in 2012, and we're basically going on to 10 years later, she's definitely one of my very, very good friends from nursing school. Okay, so the next one is, how do I find a clinical preceptor for clinicals? Okay, how do you find a clinical, tips on finding a preceptor. Okay, basically, long story short, how do you find a preceptor for clinicals? I think this question is more so nurse practitioner related, not like undergrad, like not RN or LPN related, because your school will provide you the clinical placement. Luckily, the school that I went to Pace University, and they have a partnership with a facility where they actually place their students. Well, not one facility, but they have various partnerships where they do place the students. So we didn't have to deal with the, the headache that comes with finding a preceptor. I do have a few friends who have had these type of experiences where you do have to make your own, you gotta put your best foot out there and see who will be your preceptor. I think I don't know too much on this topic, but I would say maybe I would probably suggest finding early on, like the minute you are accepted into a program, start rubbing elbows and rubbing shoulders with people who are within the same field that you want to get into. So yes, you want to be an NP, start making friends with NPs, start making friends with doctors, because by the time you're ready to find placement, you don't want to be putting up on them last minute, because they can easily say no. They can have somebody else that took your place. The earlier you're able to put your foot out there and speak to them, I think you have a better chance of getting a yes from them. And I believe once you secured a credible, quality preceptor, it's just a matter of just doing the hours, and I believe that the preceptor gets some type of conversion to where the preceptorship or the hours that they are using to precept somebody, it goes towards their accreditation or their recertification of their license. So it's kind of like, what is it called? Fair exchange, no robbery. That you get a preceptor and they're able to kind of use those hours to then recertify for their licensure, which can then, alleviate them from having to take extra tests or go to all of these different conferences and do all these continuing education credits. So it's kind of like a fair exchange. I just think the earlier the better. Okay, so the next question says, or the next question is, what specialty are you in, and do you have a dream specialty? So I'll answer this in two ways. I'll answer it as a nurse practitioner, and I'll also answer it as an RN. Let's do the RN first. So as an RN, I worked on a subacute unit. We call it step-down ICU, tele, med-surg, everything. So my unit specialized primarily in cardiopulmonary care, but I feel as though we had just a slew of various patients that we dealt with, which helped broaden my knowledge, because I had to be ICU and CCU trained, and the nurses on my unit, we actually float to those departments, and we also float to just the vent units, because a lot of our patients were ventilated patients, BiPAP patients, on high flow, things like that. But when I graduated nursing school, I really wanted to be an emergency room nurse. I just so happened to land on the unit that I was on and never left because I loved it. But in a perfect world, I would have worked in the emergency room as a nurse. So now, as a family nurse practitioner, obviously the word is family, the operative word is family. My practice is mainly with anybody across the lifespan. So from 1 day old all the way to 99 years old, I can take care of any of those patients. I do prefer to deal with adults because of my history with, being a nurse. I've only dealt with adults. So with peds, if I decided to really take it seriously or practice a little bit more, I would say I can be, I'd be a good, peds NP, but my main thing is adults. But if in any case, sometimes I'm able to really jump in and help the pediatricians at my job currently if they're a little bit overwhelmed. I just do like basic cases, nothing super duper significant. But in a perfect world, as a nurse practitioner, I honestly would do dermatology. I love aesthetics, I love skin, I love wounds. I love suturing. I love cysts. Even as a nurse, having to do wound care, it never bothered me. I would prefer, I mean, in a perfect world, I would definitely maybe get a certificate or something like that, just to kind of go into that avenue. I mean, it's never too late. I'm always changing my mind. I'm always bouncing around doing something different. So we never know if we'll likely switch over to dermatology, but it's at the front of my mind for sure. Okay, so this one is a really, really good one. It says how to get comfortable in a provider role. Okay, so the person who asked this question, I don't think that they've watched like my nurse practitioner journey, the videos that I put out when I literally just passed my test all the way up until now. Getting comfortable in a provider role is very difficult if you just don't have the capacity to say, this is what I'm gonna do and this is how much effort I'm gonna put into it. So some of the things that I did when I transitioned from being a student to being per diem, but even in me being per diem, I kind of was like thrown into it, and they're like, listen, we'll help you if you need help. I didn't get a full 6 weeks of orientation or anything like that. It was a matter of, all right, this is how the computer system works. This is maybe who you can call if something happens. We'll start you off slow. We'll give you about 12 patients a day, and it is what it is. I kind of got thrusted into it. I was told that you graduated as a provider and we need you to be a provider. I actually work at the same place that I did my training as a student. So they were looking at me at like, all the stuff that you've done before, what is it that you can't apply now? It's fine. I mean, it's cool. At the end of the day, I thank God that nobody killed the baby. That's a joke that my chemistry teacher used to say. I thank God that nobody killed the baby. I thank God that nothing happened, and I thank God that I still have my license in place. And my license is still active, and I haven't had any lawsuits. So what you can do, I would say, you never stop learning. It doesn't matter how old you are. It doesn't matter how old you are. It doesn't matter how long you've been in a field. You're always able to learn new things. So what, okay, I'll wait. No, go ahead, do your thing. I'll pause it. Sorry, that was my dad in the background. I don't know if you heard that, but okay, nonetheless, some of the ways that you can get comfortable as being a provider, you never stop learning. So what I will say, what I would recommend is, once you get into the field, right, you're gonna look for maybe the top 5, top 10, top 20 things that patients always come in and they complain about, or they're concerned about, and you need to try to find a way to kind of specialize or get very familiar with how you would treat certain things. So for me, I'm primary care. What's primary care? Sick visits. Patients are saying their throat is sore, or they're having, vomiting, nausea, and weird complaints of those things. You have patients who are hypertensive. You have diabetics. You have arthritis. You have COPD. These are very, very common. You have allergies. You have asthma. So these are very, very common things that I see on a day-to-day basis. So what I was able to do is, once I realized, oh, this is a pattern, I need to figure out what medications I would give if it's an emergency, because again, I'm still coming from a place where I have the knowledge of working as a nurse. If I was in a hospital, would I do this? Would I do that? Would I do this? And then if it's something that's not emergent, what are the things that I can prescribe the patient that I also feel comfortable prescribing? I am very, very big on reading notes from all different providers. I know that I shouldn't be doing it because technically you're going into charts of patients that you have not treated, but that's the only way that I can learn. So where I work, some of the patients, they get to see different doctors depending on who's here, who's not here, how emergent, or how quickly somebody can help them. So let's say I was treating a patient for something and I happen to be out for, I don't know, a week, 2 weeks, whatever the case is. If I come back and another provider saw that patient and they had a completely different intervention than I did, I look at it, I try to figure out, why did you do that? Is it something that I would do? I'll read up on more. Oh, is this a new medication that I've not heard of or I haven't tried? Or, oh, is this how you really treat X, Y, and Z? And then once I feel comfortable with that, I integrate that into practice. Aside from me reading providers' notes, I ask tons of questions. I'm the nosiest employee. I'm the nosiest nurse. I'm the nosiest NP. I'm the nosiest anything that you'll ever come across, because I'm asking questions and I'm not afraid to do so. And I also suggest that if you just don't know something, don't tell the patient that you know it, because that will never sit well. That will never sit well with the patient if they know that you're uncomfortable with something, or they find out that you're uncomfortable, but because you have maybe arrogance, or you have an ego, or you're just scared just not to seem like the incompetent person, you tell them anything, it's not gonna sit well, because God forbid whatever intervention you thought was gonna work backfires, you're gonna come back with your tail between your legs. Another question, how to pass the NP boards? I'll put the link down below. Resources for new NPs that are a must. I'll put the link down below. These are some of the videos that I've done already in the past. So whoever's asking this, maybe you're new to my channel, or you never maybe been to my channel, but check the link down below, okay? Okay, so the next question says, well, it's not a question, it's a statement. It says, sorry. All right, it says, I wanted to be a nurse for a very long time, but I'm scared and I don't know why. And I know that I will be a very good, caring one too. This person, I know you personally. And I think you would be a phenomenal nurse. One of my non-negotiables as it pertains to people entering the field of nursing is compassion. I normally ask people when they say, I want to be a nurse too. I always ask why. Sometimes the way that I ask, it might come across a little bit like, who are you to be asking me why I want to be a nurse? But the thing is that I really want to know what makes you want to be a nurse. Because people say the typical things, oh, I want to care for people, I want to help people, you know, the money's good. You know what I'm saying? These are things that's not necessarily a reason that you would want to be a nurse, because you can go into the field of nursing and completely hate it. You can go into the field of nursing because that's something that maybe your parents or your family respects as a profession. Me, I'm Haitian. Everybody's a nurse. If you're not a nurse, a doctor, engineer, a lawyer, you're basically a disappointment. So it just so happened that I wanted to be a nurse. I didn't become a nurse because of societal pressures, but there can be a cultural influence as to what career you end up going into. People want to go into it because of the money. At the end of the day, nursing is one of the few fields that you can literally do 2 years worth of schooling. Not that I say that this is okay, but you can do 2 years worth of schooling and make more than people who have done 6 years of schooling. That's not a reason why anybody should want to enter the field of nursing. Compassion is something that you will need as a nurse. Why? Because you're dealing with so many different things. You're being pulled in so many different directions. Not only are you the nurse, you're the social worker, you're dietary, you are physical therapy, you're the patient's family member, you're the person holding their hand crying with them, you're the last face that they can see when they take their last breath. So a lot of these plates that you're holding, a lot of these bowls that you're essentially juggling could make you very jaded, and you as a nurse can become a little bit insensitive to things. This is why compassion is needed. Long story short, you, my dear friend, you will make an amazing nurse. I know you, not only are you loving, not only are you caring, not only are you God-fearing, I do know that you're already in the field of healthcare, and somebody like you would be a great addition into the family, into the club, into the gang that is nursing. So if you are serious, I think that you should maybe consider it. And even if you don't consider it, just know that I think you would be a phenomenal nurse. And I don't say that to everybody. Trust me, I tell people, now you shouldn't do nursing. Okay, so this is the last question. Somebody said, did you have to deal with bullying as a new grad? Yes. So, as a nursing student, once I started to do my clinicals, I realized that I was going into a field very, very, very young. Of course, I was graduating at the age of 22, and I noticed that all the people within the field of nursing are a little bit older. And it's not just being nurses. It could be nurses aides, it can be home health aides, it could be CNAs, it could be LPNs, it doesn't matter. They're all a little bit older. And for me, I kind of created this narrative in my head that because I'm young, I don't want to seem as if I'm disrespectful to my elders. Culturally, we are very big on showing respect to those who are older than you, and I struggled with the idea of being a nurse who has to delegate, who has to maybe lead, guide, be assertive with people who are a little bit older than I am. I had a very hard time accepting that this is this field that I'm going into, and I do have the knowledge and I can do it. So of course, I end up on a unit where I was embraced immediately. I worked the night shift for 8 years, never considered going to the day shift, never. Because my night shift team, they've accepted me. You know, they didn't look at my age as a problem. They didn't look at the fact that I just came out of school. They saw how willing I was to learn, and also how much of a team player I was, and also that I know my stuff. So I never felt as if ageism was a thing until I was working with this one person. So I'm gonna try to keep this as general as possible. The person that I was working with, that I would say tried, because you're not gonna bully me, the person who tried to bully, just try to be a little bit aggressive or a little bit, you know, taunting, was an ancillary staff member who actually worked within a hospital setting for years. And at first, everything was okay, everything was cool. You know, I'm a young nurse, you know, she's cute, she's cool, whatever. But I started to notice that when I'm trying to assert myself, and if I'm trying to ask for certain things, for example, I need you to repeat a finger stick, or I need you to help me do X, Y, and Z with the patient, it wasn't a matter of okay, yeah, I'll get to it. It's a matter of, you're a nurse and you can do the same thing. Now, anybody who's worked with me, and if you're watching this video and you know me, you can vouch that I am probably one of the more open team members, because I try my best to learn everything, so that in the event that you can't do it, I'm not gonna say, well, that's your role, you have to figure it out. I'll do it for you, because we're a team, and the patient is the person who has to win at the end of the day. So in the cases where I couldn't do something, if I'm asking you to do something for me, it's not because I'm lazy. And this particular staff member, they thought that everybody was lazy. So it wasn't because I'm lazy, it's because I literally have other things to do. So as you might look at me sitting at the nursing station and saying I'm sitting on my behind. Meanwhile, you don't even know that I'm going over the orders to make sure that the doctors do their right thing. I'm going over with pharmacy, I'm doing this, I'm reading notes. It's a lot. I'm not just sitting here doing nothing. So I did experience a little bit of pushback, and some of the comments were that, of course, you know, nurses are lazy. I did get some comments about my, you know, just being a young nurse and these new So how I navigated that is that I just continued to remain not only professional, but when I was very assertive, there's not a matter of me laughing with you. No, I'm not here for none of that. So I think they started to appreciate the way that I move, and they were definitely more open to helping me after a little bit of, you know, just a little bit of a tug and war. But nonetheless, bullying exists. Everybody knows that they say nurses eat their young. It's not just nurses. Any field that you go into, when you're a newbie, when you are fresh blood, they're gonna smell you and they're gonna try to, like, you know, they're gonna play around with you. So that is all that I have for you guys today. I hope you guys enjoyed this Q&A. This was so fun. I think I'm gonna do another one. I just don't know what exactly I'm gonna focus on. I might maybe focus on like secrets or you know, mishaps and mistakes and I don't know, accidents. I don't know, but we'll figure it out. But thank you so much for making it to the end of my video. I appreciate you guys. I love you guys so much, and I'll see you on my next one. Bye.